Maryland. We're really happy to be hosting this press conference today and so glad to have Adam here in the house along with the mayor and Vinny and Dr. Wen and Mr. Frosch. So it's a very exciting day for us. I just wanted to make a couple remarks for those of you who are not familiar with Healthcare Access Maryland. We are the central region connector for the Maryland Health Benefit Exchange, and we are responsible for enrolling people into the Medicaid program as well as qualified health plans in Baltimore City, Baltimore County, and Anne Arundel County. And I'm really pleased to say that you're standing in a spot where over the past 3 months we've received over 10,000 phone calls for people who are interested in health insurance. We have enrolled about 8,000 people into health insurance here in these offices, and so this is really the hub and where it's all been happening here in the state. So we are very happy to be playing that role. As you know, open enrollment is ending soon, so I'm hoping that today's event will spark interest for those who have not yet applied for health insurance. This is the place to go. This is the place to call. So I'm just happy to have you all here today, and I can't wait to hear what my colleagues have to say. So turn it over to Vinny.
Thank you, Kathy. Thank you very much. Thanks so much, everyone, for coming. My name is Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition. I want to start by thanking Healthcare Access Maryland for hosting this event. You know, last year we had some problems in Maryland across the country with websites and things like that, but we still enrolled hundreds of thousands of people in healthcare because of the great work of Healthcare Access Maryland. So let's have a big hand for Kathy Westcott and Healthcare Access Maryland and all of the wonderful staff here who made that happen. It took a lot of work, but they did a wonderful job. Now this year, everything's working great. Thank you, Carolyn Katraki and Maryland Health Connection. Everything's working great. So I just want to say it again, everything's working great. You can go to marylandhealthconnection.gov and get enrolled, and everybody should be doing that. And since November 15th of last year, over 190,000 people have enrolled in healthcare. So let's have a big hand for that. That is great. But we're not done. There are still Marylanders out there who could enroll in healthcare and don't know about it, and they need to do so. We're here to tell you two easy things. Call 211 and go to the website, marylandhealthconnection.gov, and find out and get enrolled. Our goal at Maryland Healthcare for All is to make sure that by February 15th, the end of open enrollment, every Marylander who's eligible for healthcare gets it. And we can't do it, of course, without key supporters like 1199 SEIU. Let's have a big hand for the Purple Crew over there and all the work that they're doing. And some of the people who helped us with this ad, like Riverside Health. We got James Davis over there. Where's James? Thanks for coming. And of course, 211, who's made themselves available to be the place to call. Jim McGill is there. Thanks, Jim, for all you're doing. Thank you to everybody. But we are not going to rest until every Marylander who's eligible for health care gets it and does what they need to do to get the health care they need, because when they enroll, we all benefit. Remember, when people get health care, they don't use hospitals and build uncompensated care, and we all benefit from reducing that hidden health care tax. There's been tens of millions of dollars in reduction in the burden on all of us, so we are all benefiting here. But how do we get the message out? We believe that one of the best ways is with radio. And we are thrilled to have a radio ad featuring Mr. Adam Jones. That's a big hand for Mr. Jones for doing this radio ad. He's going to talk in a few minutes, but what I'm going to do right now, if I can work the technology, is play for you the radio ad that started playing today, and it was produced by Strategic Campaign Initiatives. Lynn Lucci's over there, a great firm that does this kind of work. So I'm going to play this, and you're going to hear how great it is. If I can do this.
Welcome back to Sports Central. Our guest today is All-Star center fielder Adam Jones. 96 wins, and personally you batted .281 with a .469 slugging percentage. So what's the most important number for you?
It's 211.
What's important about 211?
On the telephone, you can now call 211 for help with health insurance.
What?
Yeah, there's a new way for people who don't have health insurance to get low cost or free coverage. Call 211 to get information about eligibility.
Now, wait a minute. I have friends who need health insurance. What do they do?
For information about free or low-cost health insurance, pick up the phone and call 211. Or go to the website marylandhealthconnection.gov to enroll.
Adam, thanks.
For healthcare information, call 211 and you'll be connected to the agencies that can help you with eligibility and enrollment. Sponsored by the Maryland Citizens Health Initiative Education Fund.
So, ladies and gentlemen, this ad is playing all across the Baltimore area until open enrollment ends on February 15th. We're thrilled about that. And we have some people here who are going to tell you how important this is. And I want to introduce first our wonderful mayor of Baltimore, Mayor Stephanie Rawlings-Blake. This mayor has done so much to make Baltimore a better place, to make it a healthier place for all of us. We have loved working with her since the Affordable Care Act passed. She's been out there getting people enrolled. That's one of the reasons we have so many people enrolled around Baltimore and around the state. We thank the mayor for her leadership, and we thank her for being here today.
Thank you
Mayor?
very much. Thank you, Vinny, so much, and thank you all for being here. This is an important time of year for so many reasons. I just left an announcement with the comptroller. We were talking about the Baltimore Cash Campaign and making sure that people knew that they had access to free tax preparation. Why? Because we want to keep more money into the homes of our family members. And this is also about keeping the resources and making sure people understand all of the resources they have available to them. And as far as when it comes to health care, I want to thank the Purple Wave, as I call you, the SEIU members who are here. Yeah. Thank you for being here. I want to thank Attorney General Brian Frosh for lending your support to this effort. We understand how important it is, and I want to thank my newly minted, I didn't swear you in yet, though, did you? Not yet. Oh, next week. All right. But she has been approved. She is council approved. That means something. You know, the city council is working with me right there. And they approved Dr. Lena Nguyen. So can we give her a big hand? Newly minted health commissioner. And Kathleen, thank you for your hard work. And again, this is an important time, and we're here today to unveil a new radio ad by the Orange Wave, the Orioles Wave, Adam Jones. I told him that, I appreciate him lending his voice to the record, but for the women here, if they had smell-o-vision, all y'all would sign up for health care. For health care. He knows it's right. So I know this new health, and it's important. The Adam Jones, from the first time I met him, he has always been willing to lend his talent and his time to help Baltimore families, whether it's an education initiative or a health initiative. I don't know of a time that he said no. So I am so grateful that you landed in Baltimore and that you have an East Coast home because you have made a difference in the Baltimore community. This ad campaign, yeah, we can clap for that. This ad campaign will only build on the tremendous success of the Affordable Care Act as seen in Maryland, as more and more Marylanders are taking the opportunity to get covered. Over 190,000 people have already enrolled since November the 15th. But I know we can do even better with Adam Jones at bat. Marylanders can always go to 211, and I want to thank the United Way partners who are excellent at 211. We have caring, qualified professionals who man 211, and I want to thank them for that, and I want to thank everyone involved in making sure that we added this special attention, this special touch to our healthcare campaign. I know we'll definitely make it with Adam on board. So again, for everyone who is here, let's get the word out. Let's make sure more Maryland families are covered, more Maryland families are healthy, and together I know we can make it happen. Thank you so much.
Thank you, Madam Mayor. Thank you, Madam Mayor, for your great leadership. I'm also pleased to introduce the new Attorney General of Maryland, Brian Frosh. As a state senator, Brian Frosh has been one of the leaders in public health issues in this state in making Maryland a healthier and safer place for all of us. We know he's going to do the same as Attorney General, and we're thrilled that he's here to talk with us about the importance of this ad campaign. Attorney General Frosh.
Thank you, Vinny, and thanks to all of you. This is a great effort. Adam, thank you very, very much for doing this. As Vinny and others have said already today, we have almost 200,000 people enrolled, and that's great, but it's not enough. We need more, and this 211 campaign is the way to do it. Vinnie DeMarco and Brian Frosch and other old folks can advise young people that they ought to get health insurance. You don't have to be old to be sick. You don't have to be old to get hurt. Adam's father-in-law, Gene Fugit, can testify to that. He took a few hits when he was a kid. He was a great tight end for the Washington Redskins and some other team before that. You can get hurt no matter how old you are. Everybody in the state needs health insurance. And having them, there's a very simple way of getting it. Listen to the ad. Call 211. I'm very proud to have been the sponsor of the legislation that established the permanent program for 211 in the state of Maryland, and this is a great way to use it. We need as many people as we can to sign up, get enrolled, get insurance, be healthy. There are great doctors who are there to serve you if you'll only get insurance. Let me just say, this is a home run for Adam Jones. This is a home run for the state of Maryland. Thank you very much, Adam.
Thank you very much. We have great leaders in Maryland who are making this happen. Now, it's my great pleasure to introduce Mr. Adam Jones, who's here, and his father-in-law, Mr. Fugit, brought him here. Thank you very much, Mr. Fugit, another superstar in sports history. But Adam Jones is just a great leader in Baltimore. As the mayor said, he's not only in sports, where he's a four-time Golden Glove winner and All-Star and just a tremendous leader on the Baltimore Orioles team. He's helped bring the Orioles magic back to the Orioles and to Baltimore, for which we were really grateful. But he's also gives back to the community through the Boys and Girls Clubs and through all he does for the Kidney Walk and so much. And we at Maryland Healthcare for All are just thrilled that he is here with us today to get the message out that people who aren't insured should call 211, go to MarylandHealthConnection.gov and get insured. You've heard the ad. It's great. Now you're going to hear from Adam Jones himself. Mr. Jones, thank you very much.
Thank you. Thank you. Thank you, everybody, for coming. It's weird to hear myself talk. I don't really listen to myself. I just hear it. But I just want to thank everybody for coming out here. Health insurance is obviously of the utmost importance in today's society, with numerous things just happening. You can be, 15, 20. You can be, 60, 70, and things can go wrong. So, like I said, getting involved with this campaign meant a lot to me because, like I said, I got family members that need health insurance that are doing the same things in various states and back west, and these are things that are a must. And I think taking care of yourself and your ability to take care of yourself and others will help out in your life, with your friendships, with a lot of different things. And, it's simple things to me. And I think by calling 221, you guys have made such a great infrastructure to get Marylanders involved and to get health insurance and get these guys covered, because they need it. Everyone needs it. And I just want to thank everybody, the mayor. You're always great for showing up. And thank everybody for coming. And let's get on board and let's get all the Marylanders involved and get everybody covered.
Thank you. Thank you. Thank you so much. Let's have a big hand for Adam Jones for all he's doing for Maryland. We wish him a great season in 2015. Now it's my pleasure to introduce Carolyn Katrocki. Carolyn Katrocki is the person who's made this system work. Thanks to her, hundreds of thousands of people enrolled last year despite some technical problems. And this year, she's built a system that's really working tremendously, one of the best in the country. Again, over 190,000 people enrolled just since November 15th. Maryland is very lucky to have Carolyn Katrocki at the head of the Maryland Health Connection, and she's going to tell us today about how well it's working and what you could do. And thank you very much, Carolyn.
Thank you so much, Vinny. Over the top, but because I have to say that it has been the greatest teamwork ever that has resulted in what, as the Orioles know about great turnarounds, what I think is a great turnaround this season. Our website is working, and yet without the people in this room, HCAM, the folks that come and help people understand the complexity of that decision, without Healthcare for All and the unbelievable leadership in helping us spread the message, we wouldn't be anywhere close to where we are today. Which brings me to Adam Jones. We are incredibly grateful. You know, best website in the world, best program in the world, doesn't matter one whit if nobody knows about it. And getting that message out with someone, from someone like you, is just immeasurable. And particularly with young people, you know, you have so much admiration, you know, in the young people here in the state, and it's sort of like, you know, young people, they think they're invincible. They think, you know, they don't understand that life happens, and sort of like having a relief, I'm going to try a sports analogy, a relief pitcher, you know, where even when you're winning, it's good to have a backup plan. That's what young people need to understand, and you doing this for us will make such a difference in that regard. So we are not only just grateful and going to tell you how grateful we are. We have a couple of mementos for you, if you could come forward. Okay, the first one is a Maryland Health Connection football, which you'll note does not deflate. It's a squeeze ball when you stretch. And then the other memento we have is some shaving cream.
Don't do it, Karen.
Someone dared me to squirt him, but I don't think I'm going to go that far. Anyway, we think you are going to be making a lot of pies this season, and
I'll take that off your hand.
I don't know if I should give it to you, but you'll be making a lot of pies, and a measure of your success is how many of these pies you make and cover your teammates with shaving cream. The measure of our success is how many Marylanders we get covered, and we're going to cover a lot more because of you. So thank you so much.
And Adam, if you could stay here, I made a terrible flaw, and we also had a gift for Adam. And I just want to say something about our navigators. In-person assistance for consumers is so important. We have over 100 people who sit down with people, help them understand insurance plans, help them pick the best plan for them. And without these individuals standing to my left, we have 98 more, we would be in big trouble. So I'd like to introduce Carolyn and Nicholas, who would like to give Adam something. So.
Thank you.
Your very own HCAM shirt.
Yay!
We were going to ask you to
That
wear
looks great.
your suit's nicer.
Oh, thank you.
Thank you very much.
I appreciate it. You're welcome. Thank you so much.
And Mr. Jones, one more gift this is something that my family makes every summer,
Oh, jeez.
and it's a jar of homemade DeMarco-made tomato sauce. And once you eat it, you'll never want any other tomato sauce ever again.
So I might be calling you again.
You might be calling me again, and that tomato sauce is so. Isn't that right, everybody? Isn't it the great tomato sauce? Thank you very much.
Working with nonprofits.
I like gifts, trust me.
The nonprofit gifts can be cool.
Thank you very much. Carolyn, did you want to say anything else, or?
No, I'm good.
Yeah. All right. Thank you very much. Did you want to say anything else, Mr. Jones?
I'm happy for the tomato sauce.
You're gonna love it. The rest of the team's gonna want some. Thank you very much. Thank you. Let's have another big hand for Adam Jones. We want to close today with some words from our exciting new Baltimore City Health Commissioner. Those of us in Baltimore have been hearing about Dr. Leanna Webb when coming here for a little while, and everything we hear about her is so wonderful. We want to thank the mayor for picking her. Where'd she go? Thank you, Mayor, so much.
Get out of the way of the shaving cream.
All right. Thank you, Mayor, for picking her, and I want to introduce our great new health commissioner, Dr. Leanna Webb. Thank you.
I don't know how to follow that. I mean, I don't have tomato sauce. I don't have a shirt. I definitely don't have shaving cream going on today. But what I do have is this. So first of all, I want to share my gratitude because I'm so grateful to be in a city where we have leaders who understand how important health is to the well-being of our community, to the well-being of our citizens. And under the leadership of Mayor Rawlings-Blake, all of us will be healthier as a result. And under the leadership of everyone around me, from HCAM to 211 to Adam Jones, we will be a healthier society. You know, I'm an ER doctor, and I worked in the ER last 3 weeks ago. And this is what I saw. I saw a young man whose throat was so swollen from an untreated tooth infection that he couldn't breathe. I saw a young woman who went for 2 years to get treated for her breast cancer, and she had cancer spread to her lungs and her brain. I saw a man in his 50s who had stopped taking his seizure medications and was in a coma. His wife said that he wasn't taking them because he couldn't pay for them. These patients were dying because they didn't have access to affordable health care. Before the Affordable Care Act, I saw these patients every day. But now that everyone has access to health insurance, or should have access to health insurance, we shouldn't have patients getting sick because they can't pay for their health care. We shouldn't have patients dying because they don't have insurance. We shouldn't have profits placed above people. Now we have a solution. Now we all know that 911 saves lives. Well, here's a different number for you, 211. 211 could have saved my patients, and it can save you. So please call, please sign up, please get covered. Your health is the most important thing that you have. So sign up today and join our mayor and Vinny and Adam Jones to get the health care you need and to get healthy. Thank you.
Thank you. Thank you, doctor, so much. Boy, we look forward to working with her, don't we, ladies and gentlemen? Thank you very, very much.
She needs her sauce, too. She's new. It's true.
Oh, my God. Mayor Stephanie Rawlings-Blake bothered me for 5 years till I gave her one, but
And I got it.
And you got it. There will be one for Dr. Wen soon, very soon. And before we answer questions, I want to recognize Ray Naomi from the Orioles. Thank you for all the help in making this happen. I want to recognize Lee Cobb from Advocates for Children and Youth, the great organization that works with us. Daryl McMillan from Radio 1, one of the stations that's airing this. We have Angelo Solero, who helps us reach out to the Latino community. The great staff from Healthcare for All, Matt Celentano. Where's Matt? And Stephanie Clapper, and Suzanne Schlottman. Suzanne, come up here with Lloyd and Chris. Let's have a big hand for the little ones who are here. Hi, Lloyd. It's such a great young man. I want to thank everybody here. We have gotten out a great message to the people. 2 things. Call 211, go to MarylandHealthConnection.com, and you will get the health care you need. Hey, Lloyd. This is my buddy. You want to say hello to Adam Jones? All right. That's great. All right. Now Lloyd will answer your questions. Seriously, any questions before we close up? Okay. Thank you all very, very much.
Camera, did you get your shot? Right at this camera right here. I'm all right, yeah.